I think where the quantum association really has a huge effect is our thoughts, words, actions, behaviors, right? Our thoughts. It starts with our thoughts and putting it out there. Like it's just so weird because you kind of seen my evolution over the years, and as a broke medical student to a broke physician, essentially, I'm kidding, but just always investing into education. For me, I'm so thirsty for knowledge. I always seek out that kind of, that thought leader in the space and try to capture, their keen insight, just so that we could push this narrative forward. I just really think that, my key takeaway from all this is our thoughts, words, actions, and behaviors. And I think you got to have fun with it too and not be
Mm,
overcritical. And, I'm trying not to curse that much, right? And for me, it's just, and we had a talk offline about this, there's certain, patients that we've seen that come through our practices, our clinics and so forth that we've identified. And it's just like, dude, it really has to deal with your thought process because
yes,
I
yes.
think I gave the example earlier where there are individuals that are super young, highly functional, completely operational, looks amazing, right? Like young and able-bodied, right? But their mentality and their thought process
Mhm.
is so hyper fixated on sickness and illness that it's almost like a learned behavior, right? And then I've got like guys that are really jacked up, right? That are really, really sick and genuinely like cachectic, frail, weak, and so forth. You could see it, but their attitude is so amazing, right? And they're like optimistic, overly optimistic, and they are thriving. Who do I have my money on to heal? The person with the right attitude, the attitude of excellence. And it's just amazing to see, how our thoughts and our words and our actions and our behaviors really shape the environment around us, right? And if there's anything, that we could take away from any of the nonsense that I'm saying that is, essentially medicine is personalized, have fun with it, go into the quantified self, become your own kind of advocate, right? But not overly annoying where you're going to Reddit to learn everything about your decisions in healthcare or Instagram. And then, I do think start connecting your own molecular dots with your quantified self, looking at how we could use wearables and things of that nature to get data and insight with like, okay, I had a glass of wine last night and my sleep score went down. Right. And then because of that, I, woke up a little bit later and that set off a whole pattern of events and chains that maybe have compromised your maximized potential and productivity. Right. So there are all these little things, these cause and effect relationships that influence our, our behaviors and our actions throughout the day. And if we could get a better understanding and appreciation of, all these different signals and inputs and how it's influencing the way we think, speak, and feel, I think we could use this and leverage it for empowerment, ultimately, right?
Beautifully said, my friend. Beautiful. I couldn't agree more. And I do think so much of it comes down. People are seeking solutions outside of themselves. They're coming to you, they're coming to this center, they're coming to all the wonderful people we've mentioned throughout this podcast, doctors, and saying, heal me. And that's never how it happens. A doctor does not heal. They assist you, they help you, they coach you. They are your biggest supporter at times, but they don't do the healing themselves. That
All right.
needs to change. And it starts in your head. It starts in your mind. It starts with your thoughts, your attitude, everything. So for anyone listening, it's like that's where it all starts. Everything we talked about, the genetic testing, these amazing, tools, everything we're excited about, none of that matters. And we know this. We've seen
No.
patients go through it, but have that terrible attitude, nothing works on them suddenly
Oh
because
yeah.
that belief
And,
system
and
is
then they're
so,
hypersensitive.
yes,
Sorry.
yes.
They're hypersensitive. I can't even begin to tell you some of the things that I've seen. And it's just like, all right, man, how are you breathing air right now? How are you not reacting to air? And it's just like one of those things that it's just like, and I'm not saying you're not ill, but I
Yeah.
also think the internal processing around your illness makes a huge, influence on your receptivity to cure, right? And again, what I tell people in my practice, I don't want to become your doctor. There's a million doctors around me. I'm in a very rich academic area, clinically, and go talk to them. I want to become your health intelligence partner, right? And
Mm,
for me, I think understanding kind of, how we leverage this information for empowerment is going to be critical because despite me being a board certified family physician and all the additional training in anti-aging and functional medicine and all the things that I do, I just want to have fun with my practice, right?
Yeah.
And that's the thing. Like a lot of my patients here privately, I mean, we have fun unpacking stuff
Hmm.
and exploring things and having a healthy narrative and conversation around, what I think, detoxing really means, like simple
Yeah.
concepts of
Yeah.
detox, whatever it is, right? I know you've had, people from the Gershon Center on your podcast and,
Mhm.
the people from all these different amazing companies on your podcast. And that's why I love you, Gaspar. You've been like, you are, a true seeker. You are somebody that wants to push the narrative forward. And I really think that when it comes down to it, you're one of my greatest teachers, you and your father,
Mm.
and I can't thank you enough for everything that you do because you're not afraid of having that conversation about like, how does this really work? Why should we use this? How do we infuse this into a therapeutic regimen? Right. And I think that's really important to have a discussion, right? And not be, you know, polarized in our conversation around this, especially kind of everything, the chain of events over the past couple of years and how polarized our country is
Agree.
with it, and it's just like, there is no right answer, man, because your answer is different than my answer, right?
Yes.
Everybody's truth's different.
Yes.
And if you believe that this is going to help you, it's going to help you. If you question if this is going to help you, maybe it's not going to work. Who knows, right? That placebo nocebo effect is really, really powerful, right?
Yeah.
And I just love the work that you're doing. And, I've been following you for years, and I'm just really excited to even have this conversation here with you today because you're just, I think, a innovator in the field and everything that you're doing.
Well, the feeling is mutual. I truly appreciate your words. And I love what you said there, making medicine fun again. That should be the hat. Make medicine fun again, right? Because too many people, there is a level of jadedness within medicine. I think we spoke about this a lot. Like my father has said, like, it used to be respectful, it used to be a collaboration. Now it seems adversarial at times, and that doesn't make it fun. Doctors get into this truly for passion of helping people. But if people don't want to be helped, it becomes very, very challenging. And then you
Yeah,
have this, it's not fun. Healing should be the whole process should be
that's
a
it.
fun and optimistic, life-giving one, right?
Yeah,
Not the
yeah.
other way around. So I really love that message. And I think we'll finish there, or else this will turn into a Joe Rogan 4-hour podcast next thing we know.